similar measures, and that includes 2 new benefits for workers whose jobs are affected by the coronavirus pandemic, expanded employment insurance benefits, and increased payments through the Canada Child Benefit. The hope is that this will be money going directly into the pockets of Canadians. Let's go to Mike Lecouture, who has been listening and watching all of this. Mike, what more can you tell us about this emergency aid package?
Yeah, so for right now, it's in the Senate. They started at 10 a.m. with an emergency session. First 2 readings that have to go through it. I'm not going to bore too many people with what the Senate will have to go through here, but they will have to go through 2 readings of the bill, and then it's something called Committee of the Whole, and that's what's happening right now. You see Bill Morneau, the finance minister there. Committee of the Whole basically means that all of the senators who are there, and there's just over 20, will be questioning him and asking him about this bill, and having the normal checks and balances that you see in any kind of committee and what the Senate wants to be, the chamber of sober second thought. And he was grilled specifically on the EI benefits. There's a lot of questions on why we are not also boosting the wage supplements. It was brought up by the Conservative Senate leader, Don Plett, saying, why isn't it more like the UK or Denmark? But in response, you'll hear here that Bill Morneau is saying that they do believe that this is the best method to get money out the door as quickly as possible. Have a listen.
So it's a simple and effective way for us to get money to people. We are working hard to make sure that that happens rapidly. We expect that the week of April 6th is our target date.
So you see there, they're hoping that it can get out the door as soon as possible, looking at other measures that could be as soon as May, and some of those child benefit checks going out the door as well, just to give people a lay of the land. After this happens, then they'll have a vote. And then what we're expecting is that there'll be the 3rd reading. They wait for royal assent, so that's the message from the Governor General to say that everything's good to go. While they wait for that, they will also have a 2nd Committee of the Whole, which will be asking the Ministers of Health and Public Safety, so Patty Hajdu and Bill Blair. This bill isn't related to them, but the senators want them before the chamber so they can ask them about what the overall plan is, 1, with the border, and 2, for the public health side of it. They want to make sure that going forward, that what is going to be taking place, how are we going to be taking care of Canadians, protecting Canadians, and remarkably enough, one Senate source told me that despite the fact that they're going to have those 2 ministers there for about 90 minutes or so, they're going to get this wrapped up by about 2 or 3 o'clock today. Kind of different from what we saw from the House of Commons, Donna, which obviously went into the wee hours of the night. But there's approximately 26 senators there representing all of the groups, the Independent Senators Group, the Conservative Senators Group, the Canadian Senators Group, which is another one of those independents, and a non-affiliated senator. So they expect this to get through by, like I said, day's end at the latest.
Well, I guess we're not expecting huge delays in the Senate, but can you talk a bit, Mike, about what happened yesterday in Parliament? Originally, we were told this emergency spending bill was going to get through with unanimous consent. Everybody agreed to it, and then turns out there were some measures in the draft bill, at least, that took a lot of people by surprise, and giving sweeping powers to the finance minister to tax and spend until the end of 2021 without any parliamentary oversight. Assuming, I guess, that Parliament could never reconvene and therefore it was necessary for the government to have these extraordinary powers. That's been reeled in, though, right? Morneau has some special powers now, but not as much as was originally proposed in that draft bill.
Yeah, and of course there's negotiations that were going out throughout the night. We're hearing from different sources as to how those went. One source told me that as soon as the Bloc Québécois got their assurances that the aerospace industry would be taken care of, that they basically walked away and said, okay, this is good enough for us. We don't need unanimous consent in the House, which is what actually was proposed originally, that everybody in the House had to agree with this bill going forward. But the Bloc Québécois was ready to just let that go for a House vote. And the numbers in the House show that if you have the members of the Bloc Québécois and the members of the Liberal benches vote together, something will go through, anything will go through. This package would have gone through. And so essentially, you had the 2 other parties, the NDP and the Conservatives. kind of looked at the block and said, I thought we were all in this together, guys. But anyways, they continued to negotiate into the wee hours of the night to hammer out these, to put, not to put the government in a box, but at least to have some sort of oversight. So what we're also hearing is that the Health Committee and Finance Committee can now meet via teleconference. We know that there are limitations put on travel, and there could be even more limitations put on travel. These MPs don't want to be going on planes and coming to Ottawa every time they have to meet. So that will now be baked into this legislation to ensure that if there is some sort of oversight that is needed to check some of this legislation or to check something that the finance minister or a health minister feels like they need to do, that this committee can quickly come together via teleconference, have discussions, talk to the ministers, and make sure that these checks and balances are in there. I mean, our system is based around an opposition making sure and keeping an eye on what this government is doing. And the opposition, it's not job justification, but they're trying to make sure that they don't just hand a blank check or all the power in the country to this government to do as they see fit. And I think it's a bit of once bitten, twice shy. You saw when the House first broke a few weeks ago, there was a lot of goodwill. You had Mark Strahl, who was the whip or the House leader of the Conservatives, say, look, we think that this government will do a good enough job. This is as many powers as we feel will be good enough. And then, we can get back here on April 20th and then all talk about this, but we're ready to come back at any point. And I think they feel like that goodwill was a little bit eroded when you saw what came out, especially as you mentioned, Donna, spending powers for this finance minister until December 21st. And I think the government was looking at it in a sense of, we need to make sure that we can pivot. The Prime Minister said it yesterday. We need to react quickly and respond quickly. But at the same time, this opposition said, look, we're with you here, but we're not just going to hand you everything and just so that you can do this until as long as you want. I think everybody is looking at this and saying, look, if we can aim for September, the hope is, everybody's fingers crossed, that we'll be through all of this. And then if not, we can re-examine it then. But at the same time, having those committees, and that was part of that negotiation, having those committees to meet via teleconference to be able to say, okay, we can still have an eye on what's going on in Parliament. And it seems like finally, in the wee hours of the night, everybody agreed to it. The bleary-eyed MPs who had unanimous consent on it, and now going through the Senate, and as we said, Donna, expecting that will receive royal assent later on today.
All right, Mike LeCouture, thanks. Let's go to Mercedes Stephenson. Mercedes, you're working from home like so many people. Interesting to hear that, the committees at least are going to try to teleconference now, and the committees of the House of Commons to try and get things done. Oh, apologies, we don't have Mercedes Stephenson. I'm sorry, we're all working at a distance here, and I was told Mercedes was ready to do this. Mercedes Stephenson, our Ottawa bureau chief, of course, broke the story about this contentious part of the draft bill that was giving the government's unanimous powers until the end of 2021. That part of the contentious bill has been withdrawn. So I want to remind you why we're here. We're waiting for the Prime Minister to speak. He's going to emerge from his home, Rideau Cottage, shortly. We're hoping in the next 5 minutes or so to bring us more of the details of what's in that bill, what Canadians can expect from the government to support them. The Finance Minister is saying he hopes that cash can begin flowing to Canadians by April the 6th. We know a lot of people have to pay their rent on April the 1st. So this is a matter of real urgency for a lot of people out there who have lost their jobs or are their small businesses are suffering because of this pandemic. This is happening all over the world, of course, including in the United States, which has become a real hotspot for the coronavirus. There are, I think yesterday, the United States had the biggest single-day increase in number of new cases. And the government there, too, trying to help Americans who are affected by this. Let's go to our Washington bureau chief, Jackson Prosco. Jackson, there's a $2 trillion package that has been approved in the United States for Americans. What can you tell us about that?
Hi, Donna. Well, Democrats, Republicans, and the White House have at least agreed on this package. They still have to pass it, but it seems like they are at least on the same page. And so what they're looking at in this country are direct payments to individuals, where they're talking $1,200 per person, $3,000 per household. They're looking at propping up struggling industries like airlines and hotels and hospitality. They're also looking at loans to hospitals and medical professionals because, remember, it's private healthcare down here. And some of those hospitals are saying that they are struggling to stay afloat right now, given the massive costs that they face at the moment. So, Donna, all of this is coming together. It's helping the markets. They surged yesterday. They're up slightly today. This seems to be what people have been waiting for. And now it's just a matter of getting everyone to vote and sign off on it. Similar story to what's taking place in Canada in that regard.
Yeah, interesting. And, in terms of timeline, what all the medical experts are telling us in Canada, in the US, around the world, is that we're in this possibly for certain for weeks, possibly for months. And yet the President of the United States yesterday gave his own timeline, which shocked a lot of people. Here's what President Trump said.
I said earlier today that I hope we can do this by Easter. I think that would be a great thing for our country, and we're all working very hard to make that a reality.
So, April 12th, there are people in the United States, senior public health officials, who are saying, well, if that was possible, and if he had the power to do that, he would put millions of lives at risk. Could cost millions of lives. But I guess the other thing, Jackson, is that the president doesn't actually have the authority to sort of get the country working again anyway. So much of what's happening there, as here, is governed by what happens at the state level.
No, you're absolutely right, Donna. And to give you an example of that, shortly after President Trump came out and said he wants everything back and up and running 18 days from now, the mayor of Washington, D.C. came out and shut down all non-essential businesses in this city where the president lives for at least 1 month. And that's what you're going to see across the country. It's a patchwork of state and local officials deciding what's best for their jurisdictions. The president cannot override that as much as he might want to. And there's simply a reality factor out there as well, where medical advisors, even those who are appearing with the president at these daily briefings, are saying, look, Mr. President, it's nice to have a goal in mind, but you have to be flexible here. You have to consider things on a day-by-day basis. New York State, which has seen 60% of the cases in this country, 25,000 confirmed cases, more than 300 deaths in New York State alone. They've said they don't expect the epidemic to peak in that state for 14 to 21 days. How could you possibly get back to normal business if that was the case?
Not possible. So, which raises the question, Jackson, why does the president say things like this? It did help the stock market yesterday, that's for sure, as did the $2 trillion coming in. The government support, not just in the United States and Canada, but around the world, these stimulus packages do seem to buoy the stock market. But is that what's motivating him?
It is to a large extent, Donna. He's a president who ran on the economy. It's an election year, and a down economy is not good for any president seeking re-election. He has tweeted multiple times and said out loud as much that the cure shouldn't be worse than the problem itself. And there are a lot of people in Trump's corner, conservative commentators, conservative media, who are all echoing the same message that the country shouldn't be shut down because of a disease. In their words, and I'm paraphrasing here, but they say, look, tens of thousands of people die from the flu or an automobile accidents, and those aren't grounds to shut down the country. And so they're acting sort of perplexed as to why a pandemic would be good enough to shut down the economy. Obviously, you talk to any healthcare expert and they say this is a dire situation. Just look at the rates of hospitalization, if not the fatality rate itself, and you can understand why the country needs to be shut down, why people need to stay home, why businesses need to close. But the president seems to be operating on his own timeline here. And in fact, Donna, he is only a little more than halfway through his own White House campaign called 15 Days to Stop the Spread. And yet here he is downplaying the risks and musing about restarting the economy.
Yeah, it's increasingly hard to actually listen to what he says. And I think a lot of people here, anyway, tend to tune him out because what he says is so, and at times, so dangerous. But Jackson, let's talk about the issue of testing in the United States. The country seemed to be far behind some other countries, including here in Canada, in getting an early handle on where the clusters of cases were. We know there were some in Washington State in the Seattle area and nursing homes, and they sort of were able to capture that and do a lot of contact tracing there. But in the rest of the country, in particular in New York City, things seem to have gotten completely out of hand, and tests are really limited still.
It was very, very slow to ramp up, that's for sure. In the early days, it seemed as though there simply weren't enough test kits available, for example. There was confusion over whose test kits should be used. Labs were slow to roll out testing. An example here in Washington, D.C., if you were getting tested, your sample had to be sent to North Carolina, and then it could take up to 7 days for results. They're speeding up now, and the number of test kits has been rolled out. And New York State now says it has the highest per capita rate of testing of anywhere in the world. So that's some good news, and that's why you're seeing this surge in confirmed cases. But the point is, as you point out, they were late to the party here, and I think that allowed this to grow rapidly. It has grown to the point, Donna, that health officials are now saying to Americans, if you've been to New York City recently, you need to go home and self-isolate, Donna.
I'm going to interrupt you, I'm afraid. Thank you, Jackson. Let's listen to the Prime Minister.
Figure out what needs to be paid and how to plan for the coming months. If you've been laid off, had your hours reduced, or are worried about your industry, these might be really stressful decisions. Far too many Canadians are having these tough conversations about finances and their future. Just look at the numbers. Last week, almost 1 million people applied for employment insurance. The hard truth is that people are out of work because of this crisis and worried about what comes next. So I want you to know that we'll be there to help you. Our government is doing everything we can to be there for you. Tôt ce matin, la Chambre des communes a adopté un projet de loi d'urgence pour aider les gens le plus rapidement possible. Le projet de loi est maintenant devant le Sénat. J'espère que son adoption va se faire rapidement pour qu'on puisse aider les Canadiens dès que possible. On aura plus de détails pour vous cette semaine et d'autres mesures à annoncer. Et ce n'est qu'un début. Mais cette nouvelle loi nous permet de prendre les mesures nécessaires pour vous appuyer tout de suite. On va notamment bonifier l'allocation canadienne pour enfants et reporter de 6 mois la date de remboursement des prêts et bourses étudiants. Et surtout, avec cette loi, on introduit la nouvelle prestation canadienne d'urgence. Cette allocation remplacera les 2 allocations qu'on a annoncées la semaine dernière, soit l'allocation de soins d'urgence et l'allocation de soutien d'urgence, pour simplifier le processus. Comme je l'ai dit depuis le début, à mesure que la situation évolue, on s'ajuste pour mieux vous aider. La prestation canadienne d'urgence donne 2 000 $ tous les mois pour les prochains 4 mois aux travailleurs qui sont privés de leur chèque de paye à cause de la COVID-19. Donc, si vous avez perdu votre emploi, que vous travaillez à temps plein ou à contrat, ou que vous soyez travailleur autonome, cette prestation est là pour vous. Si vous êtes malade ou en quarantaine, ou si vous prenez soin de quelqu'un qui a la COVID-19, cette prestation est là pour vous. Si vous devez rester à la maison sans toucher de salaire pour prendre soin de vos enfants ou de vos aînés, cette prestation est là pour vous. Et même si vous avez encore un emploi, mais que vous ne recevez pas de rémunération à cause de cette crise, la nouvelle prestation canadienne d'urgence est là pour vous. Un portail en ligne pour soumettre les demandes sera lancé le plus rapidement possible. Et les gens commenceront à recevoir de l'argent dans les 10 jours après avoir présenté leur demande. The Canada Emergency Response Benefit will provide $2,000 a month for the next 4 months for workers who lose their income as a result of COVID-19. This will replace the 2 benefits we announced last week, the Emergency Care Benefit and the Emergency Support Benefit, in order to streamline the process. Like I said from the start, we will adapt our approach wherever needed. If you've lost your job because of COVID-19, whether you're full-time, contract, or self-employed, this new benefit will be there for you. If you're sick or quarantined, looking after someone sick, or at home taking care of your kids, it's there for you. And even if you're still employed but not receiving income because of this crisis, the CERB is there for you. An application portal will launch as quickly as possible, and people should start receiving money within 10 days of applying. I know people are concerned about delays. Families are worried about when they'll get help. It can be hard to get through on the line, and that is frustrating. Public servants are working around the clock while dealing with unprecedented demand, and all of the same personal stress everyone else is facing. They will get to your application. Help is on the way. In order to speed things up, we're rapidly deploying workers from different departments to deal with claims. In the last 10 days, we've boosted the team by close to 13,000 people to take your calls, process your claims, and get you the support you need. And since last Monday, we've already processed 143,000 employment insurance claims. That means more money will go directly to people right across the country. We're working to get you the support you need when you need it. And if you're doing okay, there's a way you can help someone else, as an employer, a landlord, or even just a friend, so you can be part of the solution. It can make all the difference, because it's by working together that we'll get through this. And our team knows that. We're collaborating with the provinces and territories, as well as with First Nations, Inuit, and Métis Nation communities to coordinate our efforts and ensure that everyone is supported. Earlier this week, with the premiers, we also discussed testing for COVID-19. We know that how long you wait for your results varies widely. The premiers and I know we need to address that, and we are. This is something Minister Hajdu and I discuss with officials every day, and we'll continue doing what's needed to speed up results for everyone. But I also want to recognize the incredible work medical professionals are doing on this front. According to Dr. Tam, we're now testing about 10,000 people a day. That's a huge increase in numbers in a very short period of time. And it's because people across the country are working tirelessly to make it happen. At the same time, we're helping companies, labs, and scientific institutions produce and supply what we need most, from masks and ventilators to vaccines and antiviral drugs. We're collaborating with airlines to get Canadians home from abroad and instructing everyone that they must isolate at home for 14 days. We're also working with our international partners on this crisis. This morning, I had calls with President Sall of Senegal and President Kagame of Rwanda to share strategies on keeping people safe and addressing the economic impacts of this pandemic. I've also spoken to Prime Minister Abiy of Ethiopia and President Kenyatta of Kenya about international coordination. And tomorrow, I'll be speaking with other G20 leaders to discuss further global coordination to our response. Plus que jamais, c'est absolument
More than
essentiel.
ever, it is absolutely essential for Canadians to have access to the last information, most recent information, and but media also bear the consequences of the situation and the virus. So in order for us to help journalists to carry out even more essential work during a crisis, our government has announced supporting measures for the media. Secretary Guilbeault will provide more details later on. But I want in the meantime to thank all the media who provide information and keep Canadians abreast of developments, facts, and reliable info. We are grateful to you for your work.
Right now,